Hello, we're going to get into the Shirley Sarhmann corrective exercises. This document is in your posture folder and it's entitled Sarhmann exercises. So I would like for, as I'm describing the exercises, that we perform them as a group in class. For quizzing and testing purposes, you will need to know the name of the exercise, which is generally just what is happening, what the patient is doing, and the purpose of them. So the first one we start off is standing hip flexion with spine straight. This correlates with the concept that the spine should be the most stable segment. And so we do not want any kind of lordosis happening here. We want the back to be kept straight and the patient to independently move their hips from their back. So if they had tight hips and they were overusing their back muscles, that may create back pain. So this is to try to reverse that and help them understand how to move from their hip joint. So the purpose is to increase flexibility of hip extensor muscles. Anytime you're doing hip flexion, you're stretching the hip extensor, primarily the gluteus maximus, and then to decrease lumbar spine flexion flexibility. Train the hips to move independent of the lumbar spine. So for level 1, you'll start with the hands on the table, and this is also called a waiter's bow. So you want to just see the buttocks kind of sway backward here with all of the motion occurring at the hips instead of the back. So go ahead and try that one as I'm speaking. Do that one for a few repetitions and really pay attention to the position of your low back. For level 2, you just take away the hand support and do the waiter's bow. So here again, flexing at the hip and not the low back. So this might be something that you would use, for people who potentially have a lordosis or anybody who has a lack of hip flexibility. The second one is the standing forward curl. And so you just initiate full spine flexion by flexing the neck and sort of imagining that you are flexing down at each segment and curling forward to touch your toes. The purpose is to increase flexibility throughout the back. Now this would be the back extensors, the trunk extensors, the paraspinals. So if you had someone with lordosis, excessive lumbar lordosis or excessive cervical lordosis, this one would work out well. I think you'd have to watch it with a kypholordotic because you are sort of accentuating that thoracic curve. But again, the purpose, flexibility throughout the back. This would be the extensors. And to stretch, you are going to get a hamstring and a calf stretch or a gastroc stretch with that. Standing on one leg, the purpose, strengthen and shorten the hip abductor and lateral rotator muscles. If you're looking at this and it looks familiar, that's good because this is the Trendelenburg sign. And so Sarhmann just took that and turned it into an exercise. So the correct way is to stand on one leg without letting the pelvis drop to the contralateral side, keeping the patella in line. Do not let the knee turn into a valgus type of formation, and keep the foot straight. So this would mean keeping the foot out of pronation, pronation or supination. But if the knee is falling into valgus, then there's probably going to be pronation there. So, and then you see the little fibers of the gluteus medius firing here. So Sarhmann definitely, this was being written in patient language, but I think it's kind of interesting that, we can turn it into, when we're looking at it, we should look at it from a professional standpoint and what it is, how that relates to what we've been learning. But this is definitely written for patient literature. So the incorrect way would be to have that pelvis drop to the contralateral side, indicating that there's gluteus medius weakness. Or if they have weakness, they may also shift their trunk to the lateral same side. So again, it's important that you remember the correct way to do these. Technique matters more than repetitions. And making sure if you needed to correct that foot posture, you could maybe put like a little rolled washcloth or towel roll or something under there to support the arch. The next one is hands and knees rocking. You see here, the purpose is to increase hip joint flexibility, to stretch the posterior hip muscles. I think you should make a note there that this is stretching the gluteus maximus. This is not stretching the hamstrings. We'll get into that. But again, with this exercise, we're having the patient on all fours, quadruped, and we're going to have them rock back. Eventually, we want them to get sort of in that prayer position, and we're getting a lot of hip mobility here. We want to, again, watch the position of the lumbar spine. We do not want it caving into a lordosis position. We want it straight, and that all of the motion is occurring at the hip joint. So if they begin to arch or get too much lumbar flexion or too much extension, that is incorrect. We really want the spine in a neutral position. Hands and knees, neck motion, movement, purpose, stretch and strengthen neck muscles. This is also called the cat and camel exercise in the clinic, and it's a very good exercise to use when you're just first starting off trying to get the patient mobile. So go ahead and get down on hands and knees and try this. And for the cat part, you're going to tuck your chin and really decrease that cervical lordosis and flatten out your low back. And then for the camel part, you're going to extend everything. So you're going to extend your neck and just let this low back really sag through that lordosis. So many people are tight in these posterior trunk muscles, and so this is a really great way to get them moving. Prone knee flexion, and again, you're going to see that there's really nothing new about these exercises, and that's what I'm going to try to bring forth, is that we're really just turning the strength test and the length test into an exercise. But here, prone knee flexion, so that's named for what you're doing. It's stretching the hip flexors. And you can see here that because we've got the knee active, it's actually stretching the one joint and the two joint hip flexors. So anytime you put the patient in prone, you're automatically going to get a little bit of stretch through the iliopsoas. And then when you have them bend the knee up, then you're stretching. This looks like a quad stretch, and it is the rectus. Remember the quadriceps, flex the hip and extend the knee. So we have to put the muscle in the opposite direction to stretch it. So relative hip extension and knee flexion here. And then the other thing with all of these, you're going to see that we want the pelvis to remain still. We want the low back to stay straight. We don't want them rocking the pelvis from side to side. So go ahead and try that one. I would say that most of you have enough excursion through your rectus that you could probably get your knee back further than just actively bringing it back. But many of our patients cannot do that. Then prone hip rotation with the knee flexed. This one will be important for one of your paper patients. This is to stretch the hip rotators and train the hip to move independent of pelvic motion. So you're going to be in prone and you flex the knee up. Go ahead and get in that position. And then you will want to move into internal rotation and then external rotation, and just do that a few times. Now, after I stop describing this one, I'd like us, Ben and I, to stop the tape. And we need to make sure that everybody knows what internal rotation of the hip looks like in this position and what hip external rotation looks like in this position. We also need to talk about if you're performing the motion of internal rotation, you are stretching the external rotators. If you are performing the motion of external rotation, you are stretching the internal rotators. So let's spend some time, let's stop the tape and spend some time discussing that. That's a very important concept, and you will need that for one of your paper patients. The next one is face-lying hip extension with the knee flexed. You see the purpose is to strengthen and increase the seat muscle, which is the gluteus maximus. And so again, this looks like, you know, what we would do for a manual muscle test for gluteus maximus, and we're just turning it into an exercise. Now I think you can see here, when the leg is coming up, we're strengthening gluteus maximus, but we're also stretching on the other side. We're actually stretching the rectus in this case, the rectus femoris, because it crosses both the hip and the knee. So this would work with anybody who has kind of that flat butt posture. When we looked at sway back and flat back, we mentioned that the gluteus maximus was oftentimes atrophied. And so this would be a good exercise, corrective exercise for that. You can use these for anybody who has just isolated weakness or lack of flexibility, but I'm trying to relate it back to the posture types that we looked at as we go. Face lying knee straight. This is again to strengthen the seat muscle. We really want the gluteus maximus firing more than the hamstrings. When you put the knee straight, you're going to tend to get maybe a little bit more hamstring activity. So one way to combat that, to really get gluteus maximus firing, is the same thing that we did with the quads, where you have the patient doing a glute set and then performing the motion. Okay, I was just making sure it was actually recording. I don't want to lose this one again. Face lying, the next one is face lying outward leg slide. This is really to strengthen the hip abductors and to train the hip to move independent of the pelvis. There's nothing magical about this one, and really, you know, I think you could easily do it in supine if you didn't want the effects of gravity, but you know, here it is. If you needed maybe to get a little bit of a hip flexor stretch at the same time, you could perform this one. Face lying foot push. So here you're in prone, you have your knees flexed up and your heels sort of clicking together, and you push the heels against each other. The purpose is to relax the seat muscle that can be causing hip pain, and shorten elongated hip external rotators. There was a typo here. So mark this one. It will be one that you will need for your paper patient, but to shorten elongated hip external rotators. So this would mean that your patient was maybe assuming a standing position with excessive medial rotation, with the feet turned in. And so we want to correct that and shorten this muscle. So this is a really good one. We know that the one external rotator that we've really focused on is piriformis. So that would be in this group if you want to strengthen the piriformis. The next one, you can go ahead and try this. This is face lying arm lifts. You note here that the elbow is flexed in A and B, and in C, the elbow is extended. And if you're looking at this and going, oh, this looks like a mid trap and low trap manual muscle test, you are exactly right. So remember, we said that anybody that had an excessive thoracic kyphosis is probably going to have lengthening of these muscles and therefore weakness. So we want to have that scapula coming down and in. I think you will find, maybe even in yourselves, that this one is very weak. So go ahead and try it. And again, the thumb should be facing up. The elbow is flexed to get the mid trap. The elbow is extended to get the low trap. We lengthen the lever arm here. Face lying, hanging arm lifts. This is just to strengthen and retrain back muscles, arm hanging over edge. You want to always watch the position of the back with all of these. You're going to see that as a theme of Sarhmann, but thumb pointing upward, and we're just performing flexion and extension. Again, if you really needed to work on somebody, training them to try to keep that low back from moving, I think this one would be fine. Nothing magical really about it. Face lying, shoulder rotation, you're in this position, so go ahead and do this exercise. Purpose is to strengthen the shoulder rotators, train an independent movement between the scapula and the humerus. And so looking at this picture, this is definitely just internal and external rotation in prone. This is the way that we learned how to do manual muscle test. And so when you're bringing the arm up this way, this is external rotation. When you're moving it down this way, that's internal rotation. And so Sarhmann just took the manual muscle test and turned it into a strengthening exercise. If we want to make this harder, obviously we're going to add resistance in the form of TheraBand or a hand weight. Now, please highlight and underline these exercises for the lower abdominals, the external obliques. And so for our purposes, we're going to call the lower abdominals the external obliques. We're going to call the internal obliques the upper abdominals. And some of those fibers will be blending, and that's not completely accurate. But for our purposes, just so that we really get a hold of the lower abs controlling the anterior pelvic tilt, that's what we want to name them. And then Sarhmann mentioned it in this exercise as well. So you will need to know these exercises for the quiz. There is one of these being demonstrated. There'll be one of these demonstrated on the quiz, and you'll have to name it. But Sarhmann gave 5 levels of this for progression. It's really good progression. And the first thing that you start with is just your patient palpating on their lower abs. So it's the external obliques fibers run in this direction, just like if you were going to put your hands in your pocket. The external oblique fibers run this way. The internal oblique fibers run that way. And so the combination of internal and external obliques really create a natural corset around the spine, much as we would use, a lumbar corset on the outside of the body. So it's very important, and many people have a lot of weakness here in their external or lower abdominals. So you're going to start off by them doing a posterior pelvic tilt and palpating that. Then you're going to move into levels 1A and 1B. Here you'll have the patient bring one knee greater than 90 toward their chest, performing a posterior pelvic tilt, and then lifting that opposite leg toward the chest and then bringing it back down. So let's all get on the floor and try this one. You're going to be in supine. Go ahead and assume a posterior pelvic tilt. Bring one knee greater than 90 towards your chest and then lift the opposite leg and then bring it back down. That one's pretty easy, but that's where a lot of our patients will start from. Then the progression is for 1B. Here we just put the hip at 90. So again, same procedure, flatten the low back, palpate the muscle contraction. Have your patient lift one leg to 90 degrees of hip flexion and then bring the opposite knee to the chest. This doesn't, it just, the foot goes straight back down. It doesn't go out yet. So we've essentially created a very short lever arm by putting the knee in flexion. And these are progressions. So as soon as the patient, gets good at this one and can do 2 or 3 sets of 10, then we're going to go to the next level. Level 2 is, I kind of think of it as an active assist. You're going to do all of the same things first. Set the low back, pulling the abdomen up and in, having them palpate there along those fibers of the external obliques. Bring one knee to the chest, and then this foot is going to touch the floor and stretch all the way out. So we're kind of using the floor as an assister, if you will. And then we're going to switch and do the other side. So go ahead and try that one. You're in supine. You're going to flatten your low back by doing a posterior pelvic tilt, drawing your abdominals up and in. Bring one knee toward the chest, then bring the other knee toward the chest. Let the foot touch the floor, the heel touch the floor, stretch it out on the floor, slide it back on the floor, and then up and repeat. That is level 2. Level 3, and we can just keep, you're in this position, so just go ahead and keep going here. Level 3 is a progression. So what we do is we take away the floor as an assister. So now this foot is up off the floor, and we're going to start with the same procedure. Flatten the low back, perform a posterior pelvic tilt, draw the abdomen up and in, palpate, bring one knee up, and then bring the other knee up, and then straighten it. And the idea here is that you, with all of these, that you do not lose the posterior pelvic tilt. The back does not arch. Remember when we looked at using the double leg lowering for the strength test of external obliques, that's how we know that we need to do this exercise if we identified weakness. Then level 4, once they do level 3, you can move to level 4. This is with both legs out straight. They slide up along the table and then come up. And again, you're looking for what's happening at the low back. If the low back is arching or moving into extension, or an anterior pelvic tilt is occurring, they're not performing this exercise correctly, and they're going to end up hurting their backs. And that may be why they're hurting to begin with. So always make sure that that low back is flat for all of these. And then level 5 is essentially a double leg lowering type thing. You start with the legs out straight, you bring both of them toward the chest and then back down. So this would correlate with anybody who has a lordotic posture. Specifically, we looked at kypholordosis, but you may have some patients that their thoracic spine is really in pretty good shape as far as a curve, but they've got a lordosis. Maybe they're pregnant, or they have like a protruding abdomen from a beer belly or something like that. This is the lower abs are generally lengthened over that abdomen. And so we're going to assume that they are weak, and we're going to know that they're weak because we're going to have done the bilateral lower extremity lowering test for the external obliques, the lower abs, and this is a great way to strengthen them. I use this progression a lot in the clinic, and I think you'll find it very valuable. Lots of people who have had back surgeries coming out of a TLSO, a rigid brace, they're going to have weak abs. So This would be a great exercise progression to do. The next one is back lying heel slide. Again, nothing significant here. The purpose is to do a little abdominal strengthening, but try these. You're going to be a lot better at educating your patient on these exercises if you know how to do them yourself. And I think you'll find that a lot of people do have abdominal, lots of people in the class even have abdominal weakness. And so it's basically a heel slide, but instead of really focusing on what's happening at the hip and the knee, we're really looking at what's happening with the abdominals. So once again, you're going to flatten the low back, tuck the abdomen up and in, keep that low back from arching, and slide the heel up. Back lying bent knee fallouts. The purpose is to stretch the inner thigh. Please mark this one and strengthen the abdominals. Train to move the thigh independent of the pelvis. You'll need this for one of your paper patients, one of the 3 postural exercise patients that we're going to give you after this. And again, there's nothing magical here. You're just going to have the patient slide the bent knee up and then let the knee fall out. So as the knee comes out, you're stretching these adductors. Back lying, knee to chest, leg lowering, purpose stretch seat muscle and hamstrings. Now, please do not tell me that this is a hamstring stretch. This picture, mark this. This is not a hamstring stretch. Right out to the side, this is a stretch for gluteus maximus. Anytime you do hip and knee flexion, or really the hip flexion part, you are stretching gluteus. Now you're also stretching the lumbar extensors. And so again, if you've got somebody with kyphal lordosis or any kind of lordotic, excessive lordosis, you can do this one because you're also stretching the lumbar extensors. So right out to the side here, this picture, I'm stretching lumbar extensors and hip extensors. It's not until you straighten the leg for the second part of this that you are stretching hamstrings. And so we need to take it back to, how do I know that hamstrings are tight? We looked at the hamstring test, length test, and we said that angle should be about 80 degrees with the knee straight. Some of your postural types would be like kyphal or sway back and flat back patients with those postures are going to have tight hamstrings, but this can be, lots of people have tight hamstrings. So we're just turning the hamstring length test into an exercise. Then let's perform this one, back lying hip flexor stretch. Hopefully this is the Thomas test. And so you see here, the purpose is to stretch the hip flexors. So all Sarhmann did was turn the Thomas test into an exercise. So you can do this one again. We learned how to do the Thomas test last lab, so I'm not going to go into a lot of the procedure here, but you see how it's done. If I want to increase the stretch of the rectus, I can manually be here and trying to take that knee back into a little bit more flexion. That's going to increase the stretch. So this exercise is going to be necessary with anybody who has an excessive lordosis. And the one that we looked at in particular was the kyphal lordosis. They're going to have tight hip flexors. And so this would be a great exercise to do with that one, to stretch out the hip flexors. Back lying straight leg raising, stretching hamstrings. Again, nothing too, that needs added to that. That is the hamstring length test. And so it's also, we just turned it into the exercise. I would say, once again, to watch the abdominals. You want to keep that low back flat. The supine trunk curls, partial sit-ups. Strengthen the upper abs, upper abdominal muscles, which are the internal obliques. So please make sure that you're comparing and contrasting the internal obliques with the external obliques. External obliques are going to control the pelvic tilt, most specifically controlling the posterior pelvic tilt, keeping the pelvis from tilting too far anteriorly. The internal obliques, we're naming those as the upper abs, and so it's like a partial sit-up. So here's the progression now. When we looked at strength test, this was the 5, where they put the arms behind the head and lift so that the inferior angle's clear. That was out of Daniels and Worthingham. This was the 4, arms across the chest, lifting so inferior angles clear. The 3 was here with arms out straight, lifting high enough for the inferior angles to clear. So, you know, it's very interesting again that this is just the manual muscle test in forms of an exercise. So go ahead and try this one. What about, would this be a good exercise for somebody with a kypholordosis or anyone with an excessive kyphosis? Probably not, because you're accentuating that curve. Backline pec stretch, pec minor. We looked at the length of this. I feel like this is the best way to stretch the pecs, to do a manual stretch versus the corner wall stretch. But, you know, many people still use the corner stretch. So go ahead and try that one. The back line, arms overhead, what does this look like? This was the latissimus dorsi length test. The purpose is to stretch the trunk muscles that originate off the shoulder blade and attach to the arm. So Sarhmann is using patient language, but this is what we said the latissimus, the rhomboids, and the teres major stretch look like. So the important things here are that you keep the low back straight and the arms come overhead. If the back begins to arch or go into an anterior pelvic tilt, you need to back off and make sure that low back is flat. It would be much better, and you're not getting a stretch if you let them go ahead and bring the arms all the way back when that's happening. Stop and do the stretch where the low back is in good position. Backline shoulder rotation, again, this is just the length test that we looked at for shoulder external and internal rotation. If you are performing external rotation, if the patient is performing that motion, we are stretching the medial rotators. So think to yourself, what was the length of that? What goniometric number did I need to have so that I could say that the medial rotators had adequate length? Same thing with here, when the patient is performing medial rotation, we are stretching the lateral rotators. So go back and review, what was this angle for normal length of the lateral rotators? So she just turned the length test into an exercise. That's really what I'm trying to drive home here. The sideline leg lift with outward rotation. This is a good way to strengthen gluteus medius in the open chain. And she's got a progression here, but essentially you're starting off with the knee flex. So go ahead and get in this position, and you'll see that this is pretty tough to do. You will need this one for one of your paper patients where there's stretch weakness of the abductors. So then we start with the knee flexed, we turn the leg out, then we extend the knee, making sure that patella is staying upright, that we're not internally rotating, and then we perform the abduction. So that will hit the gluteus medius strengthening. Now, the other cool thing is when you're coming down, when the leg is coming back down, this hopefully will look to you like the Ober test. And it is. She even has the errors in the test as far as what not to do during the exercise. So this part of the trunk needs to stay down on the supporting surface. That was one of the errors of testing that we looked at with the Ober, and the kneecap facing upward or rotating outward. If you let the leg fall into internal rotation, you've lost the stretch over the tensor fasciolata IT band. So this particular part of the exercise is stretching the IT band tensor fasciolata. When you bring the leg up and perform this part of it, you're strengthening gluteus medius. So you want to be, very prescriptive about what it is that you're doing. So you will need both of those for one of the paper patients. You can underline that. Side lying inner leg lift. This is just good old adductor strengthening. This is the manual muscle test. So remember, if I'm performing the manual muscle test, I'm stabilizing this top leg as the examiner. I'm having the patient lift this bottom leg up. So I'm strengthening adductors. You'll need this one for your paper patient. But once again, it's just the adductor manual muscle test. Sitting hamstring calf stretching. I think this is a good one. You can go ahead and try this one. It's the whole part here is that you maintain the back in an anterior, the lumbar spine in an anterior pelvic tilt, and then do your leg lift with straighten the knee and flex the foot. So stretching the hamstrings and the gastroc. It's a good way to do it, and you'll feel a really good stretch. But now I want you to go ahead and let your spine curl, and you'll see that you lose that stretch. So that one would be a good one if you can't get your patient down into supine and do hamstring stretching. Standing against the wall, forward arm lift. Teach normal alignment, promote balance of muscles. So mark this one and the next one are going to be, you're going to literally hit everything that you need to correct kypholordosis. So what you do is you have your patient stand against the wall. So you all can go ahead and find a little bit of the wall to do this on. Bring your heels about 3 to 6 inches out from the wall. You go ahead and tuck the low back. So you push your low back against the wall, creating a posterior pelvic tilt, which is eliminating that lordosis, lumbar lordosis. Then you're going to do a chin tuck with your decreasing your cervical lordosis against the wall. And then as you bring your arms up and back, you are going to be, actually, I think the next exercise is better for this, but you're going to be strengthening the muscles on the posterior aspect or the trunk extensors. But this one I really feel like is the best out of the two. So go ahead and keep yourself against the wall like we talked about, chin tuck, flatten back. If your patient is really having a hard time reducing that lordosis, you can have them go into a little bit of hip flexion, so a little bit of slide down on the wall. The arms come into high guard and they should be up against the wall, tucking that chin and then lifting the arms. And so this one is excellent because you're stretching through the pecs with that kypholordotic posture. There's going to be a lot of pec tightness. So you're stretching here and you're strengthening on the posterior side, the thoracic extensors and the middle and lower traps. So you're literally hitting every correction when you use that one with kypholordosis, and that's going to be one of your paper patients too. Here to strengthen lower trap, so you face the wall and you have your arms up against the wall and then you lift them off of the wall, bringing the scapula down and in. this is an excellent way to strengthen lower traps too. We like to put people in prone and do it, but sometimes they just can't tolerate prone. So this is a good way to get it in standing. Again, I would just make sure that the back is not arching and that the motion is actually occurring through the scapula. So that is a review of the Sarhmann exercises. Please make sure you know the name and the purpose. And then we're going to get into the 3 different paper patients. Please use these to come up with how you would correct those particular 3 postures. Thank you.